There's a great deal of debate right now about the concept of not-for-profit in healthcare. Being not-for-profit doesn't mean you make no profit. It means you have no shareholders. So the question is whether or not a for-profit system with shareholders is better than, the same, or worse than a not-for-profit system with no shareholders. I don't think it's that simple. Competition in our country is supposed to cause efficiency. I have confidence that the private sector, investor-owned or not, can be maximally efficient if incentives are not distorted. Medicare and Medicaid distort incentives, so the private sector is only going after the commercial insured market. That's what distorts the market. And the private sector is the minority of the healthcare market. So the profits that go to the private sector are nothing compared to the waste in the public sector. So we've got it on both hands, don't we? We've got money being used to be distributed to shareholders on the one hand in the for-profit sector, and we've got waste. Feudal care could be defined as waste. Medicare paying for people that are going to die anyway. That's waste. So what's worse, waste or profit? Well, can you decide? I can't decide. I think both have a responsibility to operate as if they're dealing with their own money. On the waste, the government needs to operate in a way that reduces waste. On the private sector side, there needs to be enough competition so you get the benefits of competition. Here's the problem with healthcare. We have competition, we don't get the benefits of competition. Here's why. You pay the same for a healthcare service, no matter who your insurer is, basically, and no matter who the provider is. You don't pay the same when you buy a car, do you? You make a reasoned decision based upon what you need, and then you negotiate. That's unheard of in healthcare because you've hired a third party, either the government if you're Medicare or Medicaid, or a large commercial insurance company if you're commercially insured, and you've stepped out of the transaction. So I believe the private sector, if it competes as it does in other sectors, can reduce the cost. I believe the government sector can reduce inefficiency considerably by not incenting the wrong behaviors, such as waste.